define a medical food. Give us sort of the difference between a medical food and a supplement.
That's a great question, and one that I think not many people are very aware of. The name supplement gives you a good idea as to what it's designed to do. A supplement is designed to supplement your diet to get to recommended daily allowances. That's all it's there to do, is to supplement. A medical food is designed to treat a nutritional deficiency or a dietary requirement associated with a medical condition. And it's important to note that that dietary requirement cannot be met and maintained through a normal daily diet. For example, you wouldn't be able to eat enough spinach to get to the folic acid level that would be included in what would be considered a medical food. Another key distinction with the medical food: they have to be manufactured in an FDA inspected facility that follows CGMP guidelines, which is current good manufacturing practices. There's also different labeling guidelines when it comes to a medical food versus what you find over the counter, in the sense that, what is in the product really has to match the labeling. And I think that's one of the concerns when, patients run to Walgreens, GNC, and just grab a random product off the shelf. It's the quality assurance aspect. Are they really getting what is listed on the label? And with the medical food, you can be confident that what is in the product is it matches the labeling. And then the last thing, and probably most importantly, to be designated as a medical food has to be dispensed and monitored by a licensed healthcare practitioner. If you were to ask, some of the leading experts as to what causes neuropathy, oftentimes you're going to get different answers. But at the end of the day, it usually filters back to those three things: oxidative stress, nerve protection and repair, and blood flow. So when it comes to oxidative stress, there's a lot of active ingredients out there that can decrease oxidative stress, right? You've got alpha lipoic acid being one. It's a great antioxidant. It actually upregulates the bioavailability or the production of glutathione, which is the body's most potent antioxidant. You could take glutathione orally as an antioxidant as well. So there's a lot of actives out there that can help with oxidative stress. When it comes to nerve protection and repair, vitamin B12 is involved in nerve protection and repair. So a lot of the nerve products out there are going to have methyl B12 or methylcobalamin, which is the most bioavailable form of B12, which is really important when it comes to your elderly diabetics.